But in the meantime, more on our top story, the cancellations of thousands of operations in hospitals in England to help ease the pressure on the NHS. In his apology, the Health Secretary mentioned accident and emergency as one of the services under particular pressure. Kishan Rees is an emergency doctor and joins us by Skype now from Lincoln. Good evening to you. Did you appreciate that apology from the Health Secretary?
Good evening, Gillian. Happy New Year. I think it's positive that he's coming out and he's saying that. So, yeah, I think whether patients will appreciate it as well or not is another matter, which we need to talk to them about, really.
Do you think now he really does have a handle on the problems that you face every day? Do you think it was sincere, his really admission that this is not really what he would like to be saying to the public, and that's why he offered that apology?
Well, I mean, I think it's interesting, isn't it, that I saw the Channel 4 news interview where he's talking about long-term funding solutions need to be looked at. And there has been, I can remember being on last year, every single year there's a crisis, and that can't continue. Of course, that's not sustainable. But I think we just need to look across the country, all over the media, all over social media. We've had senior doctors speaking out and airing some of their concerns. And it's very difficult for doctors and healthcare professionals in the NHS to speak out in terms of concerns about patient safety. And I think we should be applauding the fact that they appear to be being listened to. The interesting thing from my point of view in terms of how to fund things is accountable care organisations are contracts that are potentially going out to the private sector for 10 to 15 years. And there is a court case happening in terms of whether that's allowed to be, whether that's just and whether that can happen. And I think members of the public should get involved because ultimately it's their health that is on the line, and these are decisions that affect them. So they should be consulted.
The Prime Minister, though, at the same time, is saying that the NHS isn't in crisis and more prepared for the winter than ever before.
I mean, you'd have to take that up with Jeremy Hunt and Theresa May. I mean, it's interesting if they're saying different things. All I can say as a doctor on the front line, yes, there's pressures every year, but patients get treated in emergency situations. They get seen, they get assessed, they get diagnosed and treated. Certainly in Lincoln, I would be happy for my family to work there. To be treated there where I work. There's a really dynamic senior leadership team led by Meg Kelly, who's making lots of kind of positive impact to it. So you'd have to ask Theresa May and Jeremy Hunt about that. But all I can say is, as a doctor working on the front line, yes, it's difficult. But the messaging that needs to go out to patients is, if you are unwell, if you need care, seek medical attention. Do not delay. And there's a range of options available to you, whether that's GP, pharmacy, or coming to A&E if you're acutely unwell.
OK, thank you very much for speaking to us. Kishan Rees, an emergency doctor that spoke to us from Lincoln there. Thanks for your views.